for the research-based pharmaceutical industry, we have contributed a debate that focuses on one key item on the agenda of international and national organizations in the field of healthcare delivery, which specifically relates to the supply chain management for medicines.
We start manufacture of a medicinal product with individual ingredients. And forgive me, I know this is a diverse audience. Chemistry is a lot like cooking, so I may draw some analogies from the world of baking, but making a medicinal product is not entirely unrelated to making a cake, where you would start with individual ingredients like sugar and eggs. You bring them together in a vessel. You then put them in some type of reaction mechanism like an oven, and then you end up with your finished cake. Obviously, it's much more complex for us.
Responsible for delivering the cake to the patients. Our responsibility, both as IFPW and Walgreens Boots Alliance, is to take the product in its finished form from the factory, wherever it is on a global basis. We then bring that into either a regional warehouse in a specific region, Latin America, Europe, or Middle East or Asia.
My job is to ensure that the cake is spread equitably across all the countries.
I see my role in this group thinking about that we have to speak about mostly the downstream part of the supply chain, so from the factory door to the patient. And I think we have to, in all the discussions, remember that some people less fortunate need even more issues to be tackled and not to be forgotten.
These guys are really knowledgeable about every element of the pharmaceutical supply chain, and more importantly, they have serious ideas how to address the challenges and the issues and the obstacles that we face in getting medicines to patients.
Issues in the supply chain are multifactorial. It's going to take a number of solutions to come to a resolution. There isn't one answer that will fit all, so I'm very happy to be here today to have the conversation and to get the dialogue started.
Important we can highlight in this discussion the reality of the patients in the worst affected environments, in fragile environments. So this reality is quite specific. It has to do with destroyed infrastructure, it has to do with limited human resource, it has to do with very limited financial capacity. And it's important that solutions that are worked upon also take into account these particular patients that have more difficulties to access healthcare.
The level of out of stocks is unacceptable in today's modern world with all the technology that we have available to us, both in improved data and improved supply chain, that we need to make the pharmaceutical supply chain world class, which it clearly isn't at the moment.
I think this is a tremendous area of research, and with incredible improvement insight, if we can reduce the reliability to cold chain in the medical supply chain, because cold chain is an extremely huge undertaking. It costs time, resources, energy, and the day we can work without, or with, let's say, less a cold chain, it is going to change our lives definitely.
Transparency is key to the cause. We all need to be transparent about how shortages are going to impact countries and specifically patients, and we need to be able to plan for that. With regard to the supply chain, there are a whole number of factors that need to be addressed. Priority for many organizations would be data, understanding what the data needs from a country are, and using that to be able to plan.
All aspects of the supply chain to be reviewed, from manufacturer to transport company to wholesaler to pharmacy, and also all of the administrators within the supply chain to ensure that the patient actually gets the medicine that they have been prescribed either in hospital or in the retail pharmacy environment. And I think what we should do as an industry is focus on the patient and the interests of the patient.
Thank you for being here today, participating and asking questions. I think it was a good session. So thank you very much and have a nice day.